Hey, what is up, everybody? This is Cam Fats coming at you on behalf of the Cam Fats YouTube channel. Thanks so much for hanging out with me tonight, guys. I have another update for you on COVID-19 analytical data for Ohio. That's where I'm at, and I've been pretty much meticulously every single day studying the data for the COVID-19 numbers right here in my state. It's been really, really weird. It hasn't added up. The last time I checked in with you guys was on Saturday, the day before Easter. That was the 11th. All right. But I've actually done a little bit more research in the meantime. I just haven't done a video, but I want to do a video now to kind of update you guys. I found some pretty weird stuff, and it's hard for me to describe it. I'm just going to have to jump into it and show it to you. Found some videos and stuff like that I want you to see, and I think you're going to find this quite interesting. Okay, so I actually made a mind map this time to work off of, so I didn't forget to share everything with you. And I have 6 key points that I really want to talk to you about. So let's get into it, and we'll get through it. And you guys have to tell me what you think of all this stuff. It's kind of a lot of data. That's a lot of information I'm getting ready to throw at you, but I think it's worth it. Okay, so anyways, let's go ahead and share screen. Also share my audio here. Okay, so the first thing we're going to do, guys, is we're going to go over to handy dandy mind map here. So this is a 413 update, because even though it's now 414, it is early in the morning on 414. It is about 1:24 a.m. And, over here on ohio.gov, they have not updated these numbers. These were last updated on the 13th, okay, which was yesterday. These are Monday's numbers, right? So even though it's Tuesday now, just barely creeping into Tuesday, they won't update these. They won't update these numbers until 2 p.m. So technically, what I'm doing right now for you guys is a Monday update. Technically, as far as numbers are concerned. Anyways, we're gonna come back to that. The first thing I want to show you is a video that I shot last night at about the same time. It was about 1 o'clock in the morning, and I wasn't planning on doing a video, but I thought, you know what? I need to record this. Something in my gut told me I needed to record this because it was going to change if I didn't. So I recorded it so you could see what I was seeing. It was pretty amazing. Check this out. Okay, so I'm recording this ahead of time for the video I want to shoot later on today. It is 1:48 a.m. on April 13th, 2020. Okay, they haven't came out with new numbers for the 13th yet. They're not going to come out with them until 2 p.m. But these are the numbers for yesterday on 4/12/2020. So as you can see, I shot this video with the video I'm shooting right now in mind. I shot this video so I could show you these numbers right now. So let's go ahead, check it out. And the only reason I'm shooting this video right now is for one reason. Now note, when I'm shooting this video, it was last updated on 4/12. Just like the analytics I just showed you had last been updated on 4/13. So this was 1 day ago. One reason only. I want to show you this. These are the numbers I took on the 9th, okay? And the reason why the first set of numbers were taken from 2/12/2020, February 12th, 2020, is because that is when the first case of COVID-19 supposedly hit Ohio, according to these numbers. Even though it's completely inaccurate, supposedly the first COVID case, according to all official records, happened on the 9th of March. Here, according to official records here now, we had 215 cases. You'll find tons of articles talking about the first case of COVID-19 hit Ohio on March 9th. They're all wrong. According to official analytics, we had 215 cases on the 9th now. It's amazing. Okay, but when I took these numbers on the 9th, analytics showed our first case on the 12th. This was the first case of COVID-19 on the 12th. One case count on the 12th. 212. That was the first recorded case. Now, where is it at today? Now we look at it today. Okay. 4/13/2020, 1:50 a.m. We go back to the 12th. Oh, now there's 2 cases and 1 daily case count. And it goes back further. Now we had an existing case count like on the 4th. How do we have an existing case count on the 4th, but no total case count? 5th, 6th, 7th. So we had our first case on the 7th now. Our total case count was 1 on the 7th. So now, supposedly, today, we're going to put that I'm going to put these numbers as 4/12/2020, because these are 4/12's numbers. You see last update 4/12/2020. We're going to put this unbelievable 2/7/2020 numbers taken on 4/13/2020. Unbelievable. Now, supposedly on the 12th, we had 2 cases. On the 27th, we had 16 cases again. I took it yesterday. We were back down to 15. Now we're back up to 16. It just fluctuated back and forth. Completely just fluctuated back and forth. It was 15. Then it jumped up to 16. Then it went back down to 15. Now it's back up to 16. Or it was at 15. Then it moved to 16. Back down to 15. Now back up to 16. Unbelievable. These numbers are just ridiculous. Like I don't even think they matter. Anyways, I just wanted to document that in case it changed again. But right now, 4/12, I wanted to put this one down. Those are the new numbers. Let me put down for the 12th. Because that was our old official start date, supposedly. Let me see, it's at 2 now. Now it's at 2. Unbelievable, man. Unbelievable. What else is bogus? That's what I'm trying to figure out. What else is BS? Anyways, I'll be back later on today to do an official video because I got some other things I want to show you guys. I just wanted to record these numbers really quick before I went to bed. This is outrageous. All right. Anyways. Okay, guys, and as you know, I am back right now to give you some more stuff. But yeah, that was crazy, man. That was just absolutely, man, it's crazy. You know, what can I say? I'm going to show you the new numbers now. But before I show you those new numbers, let me give you a little sneak peek. If we go back to the 7th, what's the case count? 0. Now the case count's 0. Now it's back to now it's just for your reference, because you just looked at those numbers I took 24 hours ago. Now we're back to, on the 12th, having 1 existing case count on the 12th. Back to that. And if I go back to the 27th, still 16. 27, 16, 1. None of this stuff is here anymore. 7th, gone. They're all gone. Who knows what happened to them? They were there last night. Anyways, let's move on. All right, so excuse me. So I was wondering about case counts changing and why why are the case counts changing? Why are the analytics changing so much? It seems very odd to me. So it led me to an interesting video, and I wanted to share that with you guys. First, I just want to say I want to shout out to Need Input. So make sure you go over to Need Input's YouTube channel and check him out. He's doing great work. He's the one, I found this video from his channel. So if we go over here, I hadn't checked on his stuff in a while, but to my surprise, he was also doing videos on this COVID-19. So I'm not the only one seeing weird stuff about COVID-19. But this is Need Input's channel. He doesn't have nearly as much subscribers as he deserves. This dude does amazing work. So if you don't already know about Need Input, be sure to check him out. He does some amazing videos on Mandela Effect, and now he's doing some amazing videos on COVID-19 as well. Pretty awesome stuff. Be sure to get over there and subscribe and check out Need Input. Anyways, that's what tipped me off about this next video that I wanted to show you. But this video is all about it. He's a doctor and a senator in Minnesota. All right, and listen to what he has to say.
Speaking of Minnesota, a doctor and state senator from Minnesota, Scott Jensen.
By the way, KX4, this is a real news site. I will show you the website in a minute. I don't want you to think this is some kind of fake news thing. This is all real deal stuff pulled right from clips on the internet, and I will show you that site in a minute.
Joins us tonight on the 702 communication line to talk about an interesting piece you put in the Star Tribune recently as well. So I don't know if you like Dr. Jensen, Senator Jensen, but thank you so much for joining us tonight, sir. And let's start with this. You and I communicated briefly yesterday via email, shortly on the phone. Have you yet seen the information that's going into these U of M models that the governor is using to make these decisions?
No, we have not.
So what they're talking about is expanded guidelines for diagnosing someone COVID-19 positive. So they're talking about this idea of diagnosing someone as positive with COVID-19 without even really testing them specifically. That's kind of what they're talking about right here.
We have asked for those, and we were told by the governor's office that we would receive the data tonight. And so we're hoping to see what the assumptions are and what the data is. But at this point in time, we have not.
So I just want to be clear for our audience, sir. You've got a governor of a state that is making executive orders, stay-at-home orders that right now is cratering your economy. We don't know what data is being used, and yet you as a state senator, as a doctor, have not seen that data that's being used for our governor to make these decisions.
No, we have not. And
does that not concern you? I mean, shouldn't the people of Minnesota be screaming right now?
Well, I think, Minnesota.
So this is Valley State News. Just so you know, KX4 is Valley State News. I'll show you their website in a minute.
Nice. We want to be good soldiers in that, but I think that people are starting to say, hold it now. We need to have a deeper understanding of this, and we're not getting it. I think that, in Minnesota, as a physician, I received an email last week from the Department of Health coaching me on how to fill out death certificates. And I've never really received coaching from the Vital Statistics Agency in terms of how to do a death certificate. But basically, I felt like they were saying, you don't have to have a confirmed laboratory test for COVID-19 in order to make the death certificate be COVID-19.
So wait. Sir, I don't mean to interrupt you, but that and what you just said, I think is critically important. Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but I my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate, this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years. And I said, does this sound right? I had her look at the documents that I printed off. And she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning. And it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people. And I worry about that. I worry that sometimes.
I just want to point out what he just said. Fear is a great way to control people. And you got to remember something. This is not only a physician, but he's also a Minnesota state senator. And when he said that fear is a great way to control people, I think that what he's saying is that if we can keep people afraid of this thing, then we'll actually get them to pay attention and do proper social distancing and all that stuff, almost like it's like for a safety precaution. But the fact of the matter is, you never help anything by lying to people. So anyway, let's go ahead and continue with this.
We're so darn interested in just jazzing up the fear factor that, sometimes people's ability to think for themselves is paralyzed if they're frightened enough. And that's not where I want people to be. I want people to say, we're going to get through this. I'm going to use my head. I'm going to go to different sources. I'm going to listen to different sources. And I'm going to think for myself, because that's what America's about.
Senator, if you don't mind, after this interview, if you can send me that 7-page document. And just for clarity, you were sent a 7-page document by who again?
The Department of Health.
Department of Health. Saying, hey, fill this out, whether they test positive for COVID. That is stunning, sir. So Governor Walz had his conference call today. One of the things he mentioned is he's going to lay out, it sounds like, some ideas or a plan tomorrow about his statewide stay-at-home order. It was supposed to end on April 10th. He is going to have some changes to that. Do you have any new information regarding that, sir?
I don't, but there's certainly been a big push that we should be using more of a laser-focused approach rather than some sort of a broad scale whack-a-mole kind of a thing. We've got landscapers and lawn preparers, and we've got dock workers and golf courses, and there's no reason to not let those people out there doing their job. And it isn't just about those occupations I mentioned. We're also talking about a tremendously.
I got an email. I can't show it to you guys. I kind of wanted to show it to you guys, but it's just not responsible. I can't show you the email. It's not fair to my client. But I do want to talk to you about an email I received. I don't want you to think that I am saying that this is not a real virus and it's not a real disease. That's not what I'm saying. What I'm saying is I don't believe we're being told everything in a truthful way. I don't believe we're getting the whole story, whether it's because I'll talk about that after. But yeah, I got an email I need to talk to you about. It kind of puts a different light on this, but I need to show you all the facts first.
Revved up allergy season if we don't do these things. If we just let the weeds and the spring pollens go crazy, we're going to have a lot of kids with hay fever and asthma. And we know that the supply chain of asthmatic inhalers is potentially at risk. So we have to be very thoughtful when we do these things.
Doc, I got 2 more things for you, sir. Since you are a doctor, I think the people at home, because you just mentioned the fear factor, there's a lot of trepidation. There's so much uncertainty right now. As a doctor, as a state senator, and you look out to the horizon, there's a lot of varying information about when you guys are going to sort of get on the other side of this. I'm not asking you to make a certain prediction, but what's your best guess?
Well, I think it's going to be the end of April, but I think when we get there, I think it's going to be manageable. Our hospitals have done a wonderful job of preparing for it. And the fact of the matter is, we're not going to win this battle by kicking the can down the road. at some level, we're going to win this battle by having enough people become immune to it, by getting the disease. And it's a mild disease in 90% of the people. So the idea of minimizing this wave of the pandemic so that the next wave in the fall of the year will be greater, that doesn't necessarily make a ton of sense either.
Yeah, Doc, last question. I got about 60 seconds, sir. We'd love to have you back, but I actually originally brought you on because I thought you had a fascinating piece in the Star Tribune. If we can bring this up, Christy, but it says, hey, more thoughtful lockdown rules could spare loss and suffering. It was really geared towards, look, guys, we've got to obviously put public health first, but also be concerned about our economy. 30 seconds, sir. Why should people go read this piece?
Well, I think what it does is it says, listen, we're not going to have government make arbitrary decisions about what is an essential and a non-essential business. We're talking about measuring what we're trying to do. We're trying to provide some separation. We're trying to provide some social distancing. And if that's the case, we need to look at what's a safe occupation and what's not. So if two people are mowing a lawn on a golf course and they're 30 yards apart, that's not an issue. If we've got lawn people and they're working in solo or two-man crews, this is not an issue. When government goes overboard, we lose our liberties and we may never get them back. So we need to be very careful. We can do it with a more laser precision rather than just whack-a-mole.
Okay, so I thought what he said was very interesting, and it's a narrative that I'm hearing over and over more frequently, that when government, we lose our liberties from big government, we may never get them back. I don't know exactly what people mean when they say that, but I don't like the sound of it, and I'm hearing it more and more. That's the new narrative. I'm hearing more narrative being pushed about like things may never go back to normal. You know, things may always be different. They'll never go back to exactly the way they were. I'm seeing that narrative get pushed more and more, and I think it's kind of scary, to be honest with you. This whole thing's a little bit scary, though, isn't it? So anyways, let me, I wanted to show you that video, and then I wanted to kind of like vet that news agency, just so you know that that's a real news, primetime news agency on television. This is Valley News Live. They're based out of North Dakota, and this is a primetime. I believe they're affiliated with CBS, but you can yeah, you see the little CBS logo right there. Looks like CBS and then NBC logo right there. You can look this up for yourself. You can vet this agency, but this was a real primetime interview that was done. And this is KVLY 11 right here. This is a sister network of KX4. I'm not going to do this because this is going to be a long video anyways, but you can go here to this website yourself, valleynewslive.com, and you can find this report. It's not that old. This was April 8th when this came out, so you can find it. Callie Hubbard, April 8th. You can find it. It's easy, and it's him basically talking about the same thing with a different reporter. But this is primetime news. This is not some fake news stuff. This is real doctor, real senator, real reporters, real primetime news. Okay, so cool, vetted. All right, let's go ahead and close that. Close that. Okay, let me compare numbers here. Okay, so I took numbers last for you guys on Saturday, 4/11/2020. At the time, my numbers on the 12th were 1 and 1 on the 12th. Now, the interesting thing is, you saw that video I shot where these numbers had changed to 2 and 1 on the 12th, right? But on Saturday, they were 1 on the 12th. On Sunday, on Easter, they had moved to 2 and 1, right? And we had another case way back here on the 7th on Easter, right? But now, if we look at current numbers, we will see that our case count on the 12th is holding steady at 1 and 1 again. Very interesting. I'm going to go ahead and keep track of this. This is going to be 2/12/2020 numbers taken on 4/14/2020. Okay, go ahead and save that. The next one I want to get, so it's back up to being exactly where it was, I believe. Let me just double check that. 212. Yeah, one case count, one case. That's back up to where it was. Very interesting. All right, so fluctuation for no apparent reason, really, just fluctuation. The next one I've been benchmarking here is the 27th. And the reason why this date is important on the 27th is because this was a day where Mike DeWine posted an article on this exact website, ohio.gov, where he says, we have no current COVID-19 patients, and we have no patients under investigation for COVID-19. Right, and that's why that was significant. Now on 4/11, this was the day before Easter. I took the 27th numbers. Okay, right, and we see total case count was 15 and 1. Right, now I want you to know this has fluctuated to 16 a couple of times already, and if we look on the 27th now, we see it's fluctuated again. It's at 16 just since Saturday. Right, but you saw on the video I showed you that it had fluctuated. Well, I guess you didn't, because it had fluctuated back up to 16. But you can see on past videos where it had fluctuated from 15. I can very, very easily show you. If I look at my first numbers that I took on the 8th here, well, not the 8th. Let's look at the 9th, because that's when I started taking. Let's look at the 9th numbers for the 27th. We see they were at 15 and 2. Okay. Then, obviously now, it's up to 16 and 1. But you got to understand something. We're looking at numbers that happened like 2 months ago. Like they shouldn't be getting new cases analytics from 2 months ago. That's ridiculous. You know, especially when you consider, like, if I download this summary, like, let me just show you something. If I download this summary right here, and I had someone in my comment section, I can't remember their name, or I'd shout him out. He's the one who taught me this. And if you look, when you download the data and you look, what you will see when you download the data is onset date. Onset date. Now, this is the only date you get, is onset date. Now, generally, now what's this say? Date of death. Okay, so the date you get is onset date. So what this tells us is these numbers here are based on onset date. Now, what is an onset date? Onset date is the date that people start showing symptoms. Okay, the date that people start showing symptoms. Now, listen, someone doesn't come in to the ER on the 13th of April and tell the doctor that they started experiencing symptoms on 2/27/2020. All right. So that number 2 months ago should not be fluctuating. It should be rock solid. It doesn't make sense that it's still fluctuating. Very, very odd. All right. Anyways, I got 2 more dates. And these ones I really want to pay attention to the numbers, because these are the 2 dates, 4/8 and 4/9, that I've been using as a benchmark just to show how these numbers keep on being increased. Okay. So if we let's look at like our 4/8 numbers today. Okay. We got 6,372 cases. Okay. 6,372 cases. Okay, let's go ahead and save that. These are going to be 4/8 numbers taken on 4/14. All right. All right. So this is 6372. All right. Let's go ahead and 6372. All right. Now let's look at the numbers that I had on Saturday for 4/8. We will see we hadn't even crossed 6,000 yet. All right. 5511. We weren't even halfway to 6,000, and yet only 2 days later, we have far more cases, right, that were added to that day. So 5511 minus 5511. So they added 861 cases to that day, the 4/8. All right. They added 861 cases to 4/8. All right. Since the last time I checked 4/8. All right. Since the last time I checked 4/8, man. I just checked 4/8 on Saturday. Right. Now here we are going into Tuesday, but these are Monday's numbers. So that means on Sunday and on Monday, they added 861 extra patients to the 8th of April. 861 patients to that day. That's crazy, man. That's a lot of patients added. All right, yeah. So let's check the 9th and see where we're at. So 4/9, 65, 57. Let's go ahead and let me get a screenshot of that just so I can save it. 4/9. I keep threatening I want to call the government. I want to call the local Ohio government and I'm asking them about these numbers and see what's up. I'm a little bit scared because I'm afraid they're going to try to like track me down or something and shut me up. You know, you never know, man. Probably just watch too much science fiction or something, but it does kind of freak you out sometimes when you start thinking about it. But anyways, 6557. 6557. All right, so and then let's look at the numbers I had 2 days ago on Saturday on 4/9. 4/9, so it's 5512, right? 5512, right? So it's funny because like you saw the case numbers, it was 5511 and 5512, and you know on Saturday. So it looked like on Saturday the cases only went up by one, 5511 and then 5512 on Saturday for the 8th and the 9th. But now it's telling you a whole different story. Right now it's telling you a whole different story. Now if you look at the 8th and the 9th, it goes from 6372 to 6557, like 200 and something more cases on those 2 days. It's not telling the same story at all. So anyways, that was so 6557. I lost my train of thought. Sorry, guys. So 6557 minus 5512 minus 5512. They added 1,045 cases in 2 days to that day. 1,045 cases have been added to April 9th in the last 2 days, Saturday and Sunday, or Sunday and Monday. Between Sunday and Monday, they added over 1,000 cases to April 9th. It's crazy. It's like it doesn't even make sense. And especially if these are onset cases. It's like if these are onset cases, people were just coming and say, yeah, man, I started experiencing symptoms on the 8th, man, on the 7th. You know, it's like you're telling me that 1,000 people did that across the state of Ohio? Maybe. I don't know. It seems kind of weird, but okay. Anyways, let's yeah, that's odd. It's very odd. So those are the numbers I wanted to show you. Again, more number madness. Just madness with the numbers. Okay, so the next thing I wanted to show you guys is these models are changing. Okay, so listen, if we go to this is taken from a website called healthdata.org, and healthdata.org is like kind of a nonprofit organization that runs modeling data for a lot of health stuff. It's an official website, and they do a lot of information. But this PDF was taken on the 30th of March, and on the 30th of March, they estimated nationwide. They estimated that about 82,141 COVID-19 deaths are currently projected through the epidemic's first wave. Now, when they say the first wave, they mean this year, this COVID-19 season, right? They're basically assuming we're going to have a second season of this disease, kind of like the flu. Every year we'll have another season. This is considered the first wave. Like you guys might remember H1N1 back in 2008, 2009. Every year we get hit with H1N1. They just don't talk about it anymore. But it comes back every year. Matter of fact, we had a horrible season this year for H1N1. I could show you numbers from the CDC. But anyways, that's neither here nor there. But anyways, on March 30th, about 2 weeks ago, they projected, and they've been updating this. You can go further back and you'll see higher projections, but they projected about 82,000 people were going to die in the United States from COVID-19. All right. Now, let's flash forward to now. Let's flash forward to 410. Here's their current projections. Current projections, United States. Total deaths projected. This is still healthdata.org, okay? COVID-19, healthdata.org, current projections, 68,841. So you see their modeling data is going down, right? Less deaths than originally expected. When I first started hearing about this thing, they were predicting like over 1 million people might die from this thing. It was crazy. Everyone was terrified. And now it's down to 68,000. Right now, and I kind of tend to believe that it will go down even further. That's kind of what I believe. I hope so. But you see the projections are going down, which is positive. And that brings me to a point that I want to talk about in a minute. All right. But before I do, I need to get off a screen share. Okay. So let me go ahead and let me get off screen share. All right. Okay, so here's what I wanted to say. Okay, so what do I do? I'm a digital marketing publisher. Okay, I publish information on internet marketing, on how to get your business running, how to make money online, how to add an online aspect to your business. So I publish information, I publish ebooks and products and stuff like that. This is what I do for a living. Okay. And I run a company called epicconversions.com. Okay. Now, also what I do is I take on clients around the world, I take on who need help with various aspects of their business, getting it moving forward, getting it to make more money, getting it to do different things, right? Business stuff. Why am I telling you guys this? Here's why. Okay. So I had a client who I was meeting every single week. They were paying me very, very well to meet them every single week. I would show you the email, but it's just not in good taste for me to show you that email. Even if I blur out the names, it's still not in good taste. And I don't feel comfortable doing that, but I do want to tell you the story. So anyways, I was meeting with this client every single week. And I hadn't heard from them for like 2 or 3 weeks. They were based out of Australia, so quite a long ways away from where I'm at. But I hadn't heard from them for quite a few weeks, and all this pandemic stuff is going on. So I was a little bit worried. This was very out of character for this client. So I reached out to him and said, "Hey, man, I hadn't heard from you for a few weeks. You haven't been showing up to these weekly conference calls, and I just wanted to make sure everything was okay. Just hit me up and let me know. I can take you off my schedule for weekly meetings if you need a few months away because of all this stuff that's going on." Right? Just because I was legitimately just worried. I just want to make sure everybody's okay. And I got an email back from this client tonight, and they said, "Yeah, man, what's happened is someone close to me has just died from this COVID-19 thing, and it's really kind of taken me I've kind of just dropped off. I've kind of just dropped out of everything. It's kind of hit me very, very hard." So yeah, man, I'm just gonna, I'm just gonna take a month off or two from the project that we were working on, and and yeah, that's it. So that's basically the gist of what this client told me in the email, and I just got this email tonight. And the reason why I told it to you guys is because I know I'm doing these videos talking about numbers, and we're talking about how these numbers are kind of bogus, and there's a lot of like weird stuff going on that I know it makes us all kind of doubt this stuff. Like, what the heck's really going on here, man? There's a lot of stuff that's not adding up. And yeah, if you believe that out there, then I'm with you, man. I don't think this stuff is really adding up either, to some extent. But I want to make sure you're getting the whole story. So I now know somebody who was very, very open with me about everything. Like, this person would never miss a conference call. They were very open. They have no reason to lie to me about anything. There have been weeks where they were trying to get work done on their projects. They weren't able to get any work done. And this is the kind of person that would just like, dude, you know what? I didn't do anything on this project this week, man. I'm just telling you. Like, so this is not the kind of person that would lie to me about work they were trying to do or make excuses about anything like that. This is like a legit, real deal person. So when they say, hey, man, someone close to me has died from this thing, and I'm just kind of dropping out for a while because I've been taken aback by it, I 100% believe this person, right? So I just tell you guys that because I do believe this is a real virus that is affecting people. But there is that other conspiratorial side of me that says, well, there's some virus affecting people. I mean, I don't know what it is. Maybe it's this, maybe it's something else. But if I just use my logic, I'm going to just go ahead and, think about Occam's razor and assume that the solution with the least amount of assumptions is the correct answer. If I do that, then I would deduce a couple of things. Number one, I believe that this virus is real, right? Based on the information I have been given. Number two, I believe the numbers are bogus. The analytics that I'm seeing are not real. They don't make sense. And I look at a lot of analytics, you guys, as part of my job. So these numbers aren't adding up. And I've heard several people try to give me solutions to it, but none of those really add up either. The numbers just aren't adding up. And I hope with these updates I've been showing you guys that you can see what I'm seeing, and these numbers are just not adding up. With all these numbers being added later on in the game, it almost feels like they're trying to artificially flatten the curve out or something. I don't know what is actually happening, to be honest with you. All I know is the numbers don't seem realistic. They don't seem real. They seem just generated or something. Doesn't really make sense. So one, I believe it's real. Two, I believe we can't trust the numbers. And when I think about some of the videos I watched, like this doctor who was talking about being coached on how to fill out death certificates. A doctor who's been a doctor for 25 years doesn't need coached on death certificates. It's ridiculous. And you're not supposed to put things on death certificates, based on presumptions. It's only supposed to be facts that go on death certificates. If a man hasn't been tested or a woman hasn't been tested for COVID-19 or coronavirus, that shouldn't end up on the death certificate just because of, they were exposed to someone with COVID-19. So we're just going to assume they died from COVID-19. That's ridiculous. You can't do that. That's not how medicine works. It doesn't make sense. So if I assume that my numbers look jacked up and this doctor in Minnesota is basically saying that these expanded parameters for COVID-19 is going to be jacking up the numbers completely, the numbers are going to be all jacked up, which is exactly what I'm seeing. And people going back and changing numbers would explain all these extra numbers I'm seeing being added, sprinkled around all over the place. I have no idea why numbers are being subtracted from 2 months ago, but that's what's happening. But if I look at all that, and then I start to wonder if maybe that it's not quite as big of a deal as they thought it was going to be. And now maybe they're trying to save face a little bit. They want it to look like a bigger deal, maybe than it is. And that's why the numbers are getting weird. That's why they want them to put COVID-19 on death certificates at the drop of a hat without even testing. Maybe. I don't know. Maybe that's as far-fetched, I got to assume a lot of things for that. So I really don't know. What I do know is that my numbers don't add up here in Ohio, and I'm finding other people that say, hey, look, some of these things that we're being asked to do don't make sense. We've never done before, and they don't make sense. Something's not right. However, the email that I got today does make me believe that this is a real thing, that it is affecting people, and I know it's affecting people. I don't know, man. It's a scary time, no matter how you slice it. Stay safe out there, guys. What can I say? Probably going to take a smarter man than me to figure out all this stuff. But as I learn more information, I'll update you guys on it. If you like this video, if you like getting information like this, give me a thumbs up, give me a comment, let me know you're live out there, and stay safe, stay healthy, guys. I'll see you in the next one. Peace, everybody.